Welcome to the Culture of Health Leaders Program Application Informational Webinar. This is a recording of the content covered in the original webinar that took place on Thursday, March 24, 2016. Thank you for joining this webinar. We hope that this information will provide you with all that you need to complete your application if you are interested in applying for the Culture of Health Leaders Program. I'll begin this process with an overview of the agenda. To begin, we will have an overview of the programs of all of the Robert Wood Johnson Foundation Advancing Change Leadership programs, and Mary Joan Ladden, who's a Senior Program Officer at the Foundation, will review this information. Next, we will have Brian Smedley, who is the Executive Director of the National Collaborative for Health Equity, as well as the Co-Director of the Culture of Health Leaders National Program Center. He will do an overview of the program itself. To give us some more details about the participant experience, Tara Hacker, who is the Senior Program Manager from Common Health Action, she will also cover the information for this participant experience. And then finally, Teresa Llewellyn will review the application and review process. And Teresa is the Senior Program Director for the National Collaborative for Health Equity and also the Deputy Director of the Culture of Health Leaders National Program Center. We will now begin and ask Mary Joan to start with an overview of all of the Advancing Change Leadership programs. Mary Joan?
Thank you, Nahanda. The Culture of Health Leadership Program comes right out of the Advancing Change Leadership portfolio from the Robert Wood Johnson Foundation. Our mission is to build a culture of health in America where everyone has access to a healthier life. And we're looking at embracing not only health care, but also the social determinants of health that we all know are more important than, it's very important where you live, learn, work, and play, because that is very related to health. And in the Culture of Health Leadership Program, as in many of the other new programs, we're especially interested in multi-sector collaboration. The four new change leadership programs from the Foundation are Clinical Scholars, and that program is for clinically active healthcare providers who are working together in interprofessional teams to lead transformative change centered on health equity in their communities. The second program, the program we're discussing today, Culture of Health Leaders, is to create a network of leaders from diverse sectors collaborating to create healthier, more equitable communities. The third, Health Policy Research Scholars, is for full-time doctoral students from underrepresented or historically disadvantaged populations who are training to be researchers and are interested in health policy research. And the final of the four new programs is Interdisciplinary Research Leaders. That program will support teams of researchers from different disciplines and community leaders to apply health research and policy to meet the pressing needs of communities. And the two focus areas for the first cohort are early childhood and health, or housing, community development, and health. As you can see, each of these programs has a different audience and a different goal. And Culture of Health Leaders invests in you and your team as a leader, not investing in a project, but investing in leadership development for you and for your team. The four programs that I've just described are part of the Advancing Change Leadership portfolio, and we have five continuing programs that you can see here. And each of those programs, you can access information on the changeleaders.org site on rwjs.org. For more information on the culture of health and our mission and the areas we're investing in, you can see the URL here, and also for the Change Leaders programs. The email, if you're interested in information on any of the other programs, in addition to Culture of Health Leaders, you can email changeleaders@rwjf.org for more information. Brian?
Thank you very much, Mary Joan. I'm very pleased to talk about the Culture of Health Leadership Program, which, as Mary Joan indicated, is one of 4 new Advancing Change Leadership programs. The 2 co-leads of the Culture of Health Program Center are the National Collaborative for Health Equity, which works to advance health equity by measuring conditions for health, building leadership, and connecting partners in sectors to dismantle the structures and systems that maintain status quo inequality, and Common Health Action, which works to align people, strategies, and resources to generate solutions to health and policy challenges. We've selected a number of outstanding partners to assist us in this work. They include the Leadership Learning Community, the Institute for Alternative Futures, the American Planning Association, the Conservation Fund, the American Public Health Association, the Build Healthy Places Network, and the Center for Creative Leadership. These partners have been selected specifically because of their reach into several important sectors, such as community development, planning, and other important sectors of work, as well as their work to build the capacity of leaders working to expand a culture of health. Our approach is grounded in equity and social justice. The Foundation recognizes that to advance a culture of health, we first need to advance health equity, valuing all populations equally and valuing social justice. Our emphasis is on learning by doing, as expressed by the 70-20-10 model advanced by the Center for Creative Leadership. The curriculum suggests that 70% of the work is centered on action learning with the support of coaches, real-life tasks, experiences, and problem-solving through activities such as rapid startup and scale-up projects and simulations and preferred futures visioning processes. The additional 20% will leverage coaching, mentoring, formal and informal feedback, networks, and other social learning activities. And the final 10% will be focused on formal training and education. We'll use data to help identify issues, working with our leaders to understand conditions for health as well as population health status. And our leaders will work on projects that will change the conditions in organizations and communities to advance a culture of health. We're seeking leaders who prioritize equity, diversity, and inclusion, and have great tolerance for ambiguity and the challenges faced by increasing demographic change. Our leaders will work collaboratively across sectors, finding common language and frames to help advance their work and learning how to leverage the best of their sector to advance a culture of health. These leaders embrace lifelong learning, complexity, and risk-taking. These are leaders who are not afraid to enter into ambiguous situations and to help each other to learn how to best advance equity and a culture of health. Our leaders are ready to take their leadership and influence to the next level, influencing policies and systems that ultimately help to shape health. We'll select up to 50 participants in this first cohort. They can include a mix of individuals and teams, and we'll say more about this shortly. But the leaders will be from sectors that influence health, including education, transportation, technology, public health, government, the faith sector, business leaders, healthcare leaders, social service organizations, economic development, urban planning, and many others that have at their fingertips many of the solutions that are necessary to advance equity and a culture of health. I'll now turn to Tara Hackacher to describe the participant experience. Tara?
Thank you, Brian. The Culture of Health Leaders program curriculum and experience is designed to develop and support leaders through a three-year process. In the first year, we will intentionally immerse our leaders in learning and network. There will be modules that engage participants deeply in content and experience. Trainings will provide participants with an overview and focused information regarding a particular topic. And we will also focus on cohesiveness among your cohort in order to develop relationships within the Culture of Health Leaders cohort that are mutually supportive, long-lasting, and meaningful. In the second year, we will focus on leadership projects to further develop competencies and relationships, to develop competencies necessary to advance your leadership skills. We also focused on self-directed leadership competencies. And then finally, in year 3, we'll focus on implementing a BOLD project with other multi-sector team members in their community, in their sector or industry to make change toward building a culture of health. Participants will experience a phased curriculum moving from learning in year 1 to practice in year 2 and application in year 3. The training and program activities will occur primarily in your community with up to 4 convenings annually. Attendance is required for these 4 convenings for all program participants and will include interactive learning, coaching, and ample time for networking experiences. Travel and lodging will be covered by the program. Each month, program participants will participate in an average of 32 to 38 hours of learning, coaching, networking, and project work. Virtual learning will occur both synchronous and asynchronous, and each participant will be provided with robust support from program staff, professionals, as well as peer coaches. The program will offer leadership development curriculum and experiences. It will provide content that includes futures and foresight training, health equity, health policy, population health, and social innovation. There will be interdisciplinary collaboration among leaders from various fields. You will have the opportunity to implement a BOLD leadership project. It will include generative coaching methods, and there will be collaboration amongst participants in all 4 of the Culture of Health programs. Eligibility criteria include applicants, both individuals or from teams from all sectors that impact health who are committed to creating a culture of health. U.S. citizens, permanent residents, or individuals granted deferred action for childhood arrivals are eligible to apply, as well as government employees who are not considered government officials. We are looking for individuals who, eligibility criteria, there's no minimum education requirement. There's no requirement to be in graduate school, and teams may include members from the same sector if the team's work to build a culture of health will have impact on that other sector. We are looking for individuals that are highly motivated, poised to work across sectors and to build a cohesive team, and are prepared to work among complexity. Individuals will receive up to $20,000 per year, a stipend and fund, in addition to funds to complete a BOLD leadership project. Teams can consist of 2 to 4 members, preferably that represent different sectors, and they must have a designated team lead. They can represent either emerging or existing teams. Emerging teams are those that have recently formed but have worked together for less than 12 months and have not yet established a record of accomplishments. Existing teams are established teams that have worked together for 12 months or longer and that they have a track record of accomplishments, but they seek to further their impact. All team members must participate in learning activities and convening. Again, the stipends are $20,000 per year for each team member, and additional funds will be provided to implement a BOLD project. I'll turn it over to Teresa now.
Thank you very much, Tara. The next section of this presentation was put together specifically with questions that we received from the registrants for the webinar. Additionally, we integrated some of that information into other portions of the webinar. And so we hope that in this section, if your questions haven't already been answered, that we will address the questions that we've received. The $20,000 stipend will be provided to a sponsoring institution by the Robert Wood Johnson Foundation. The role of the sponsoring organization is to accept that and disperse the funds in line with the permitted use of the funds. The sponsoring institution will have to sign an agreement with the foundation around those funds and also submit annual financial and narrative reports to the Robert Wood Johnson Foundation. It's important for the applicant and the sponsoring institution to discuss the use of those funds prior to the signing of that letter of agreement, and more information will be forthcoming once the participants are selected. Team members are not required to identify the same sponsoring institution as an entire team. You may each have your own sponsoring institution. So as I mentioned, the coordination of the use of the funds has to be done between the participant and the institution. And they may be used for a variety of means, including release time and salary, and living expenses, child care, travel for lodgings. Please remember, travel and lodging for required meetings will be covered by the Cultural Leaders Health Program. So the travel that's in the stipend will be primarily for project-related work. However, if a participant decides to attend other conferences that are related to their project work but are not required by the program, the stipends can be used for those particular conferences or meetings. So the application process has raised a number of questions, and we want to just briefly talk about those. When you open an application, you will select whether you're an individual or a team. The questions will be grayed out that are not required for you to answer. So if you are applying as a team member, the individual questions will be grayed out. If you're applying as an individual, the same thing. So you will only respond to the questions required for your particular kind of applications. Individual applicants should respond to questions for the individual/team lead. For team applicants, each team member must respond to the questions as an individual. And team leaders will also respond to additional questions on behalf of the team. The questions that you're required to respond to will be dark type, whereas the others will be gray. Many, many questions have come in about the application and especially about the video scan, the environmental scan, and the video response to that question. The video response should focus on the conditions and risks that impede changes to the status quo in the area you're working in, the community, the sector, or the industry. Think about what you would do to make the necessary changes to improve the situation. How would you use tools, resources, relationships, and knowledge to be successful as you begin to build a culture of health in that community? Your video response does not commit you to working on the specific issue that you identify in the video response for the application. It needs to be a maximum of 3 minutes. It is not to be professionally produced. We've had a number of questions about that. Use whatever informal means of producing this video that you have at your fingertips. You can use your phone, your tablet, whatever kind of informal video production means that you have. The video should be uploaded to an accessible platform like YouTube, your organization website, something that the reviewers can access. please do not upload the video to the application. It will not accept it. You should only insert the link and be sure that the link works. The reviewers will not be coming back to you to ask you to provide them with a new link if there's a problem. So be sure that your link works before you hit submit. Let's talk again about the project. You may, once you do the environmental scan, identify that there's been an increase in pedestrian automobile injuries in your community. You've got data. You talk about that in your video scan. You may show some of those locations. You talk about how you'd improve the situation. This does not mean that you'll be addressing that issue in your project, your Culture of Health Leaders project. So the scan is to give us information about your view of the culture of health and also the needs of your community, particularly some of the equity issues that you have identified as you do this environmental scan. The next area of many questions is our reference letters. The application and reference letters must be uploaded by 3 p.m. Eastern Daylight Savings Time on April the 19th. The letters, we are asking you to invite your writers by April 1st to help them meet the deadline. It does indicate on the website that the letters are due by April 1st. This is to encourage you to get those completed, get those invitations out so that your reference writers meet the deadline. Their materials have to be in by the same time as your application materials. And again, if your reference letters are not there, your application will not be considered completed and will not be moved forward. Reference letters should include information about the reference writer's relationship to you and should discuss the work or your team's work and why they recommend you be selected for this particular program. The team reference letter should also include the team's likelihood of success, examples of support, or other activities, ways that the writer can indicate this. The reference writer for teams may not be a member of the team. You may not write letters for each other. And team members must be invited as participants on the team, as collaborators, contributors, prior to being able to invite others to complete reference letters. As I mentioned, the applicants are not required to identify a project in their application. There are some titles, some areas on the application that refer to project name. You are not required to identify a project for the application. The leadership projects will be undertaken in year 2. Participants will be developing individual leadership development plans, and a leadership project will be connected to that work. And then, as Tara said earlier, bold projects will be undertaken in year 3. And again, those are not identified in the application process. In fact, we hope you will use what you're learning in the program. The intent is for you to use that in order to identify those projects. We've had a number of questions also on the review process, and reviewers will represent a variety of sectors. Our partners will be assisting us with review, as well as a variety of other folks. And it is a multi-step review process. The initial review of applications will occur between the end of April and into May. I will let you know now that the semifinalist notices will be sent out on or after May 16th. So during that week, we hope to have you go ahead and receive those semifinalist notices. And if you are not selected, you will also receive a notice about that. You'll get an email. The semifinalist interviews will be scheduled for early June, and we will send information about that process out when individuals are selected, individuals and teams. And same with the team site visits. Those will be conducted from mid-June, and information about those site visits will be sent out when participants receive notice they've been selected. Feedback will not be provided on applications for either the people who are not selected or the people who are selected. So we will not be providing that feedback as part of this process. So the semifinalist review process, as I mentioned, will include team site visits. The preparation materials will be sent in advance. The review team will visit your community, and individual team members will be interviewed during that period. Your team will do a presentation. Again, we will send information about that out with the invitation letter. And there will be a tour of the community conducted by the team in this semifinalist review process. For the individuals who are being selected, the semifinalist portion of this includes an interview that will take place in Washington, D.C. Preparation materials will be sent in advance. In addition, we will work with you to schedule those interviews to come into the specific time period in which we have scheduled those. There will be panel interviews as well as a presentation. Both of these visits will be more than a day. They'll be about a day and a half, and that information will be provided. The selection criteria, I just want to reiterate, we're looking for people. We're looking for people who want to lead and demonstrate a firm commitment to diversity and equity and are very highly motivated to change the status quo. We're looking for people who, as Brian mentioned, are willing to take risks, deal with complexity, people who are willing to work across sectors. Individuals must be open to developing themselves as leaders through reflection, personal growth, development of certain masteries, as well as through increasing their knowledge and competencies. And now I'm going to go ahead and turn it back over to Brian, who will discuss the timeline for the application process.
Thank you very much, Teresa. So our call for applications opened on February 29th, and the webinar for prospective applicants is going to be offered shortly. Applications are due on April 19th and will be reviewed between April 29th and May 13th. You'll be notified if you are a semifinalist for applicant interviews and those interviews will take place between May 23rd and June 24th. Thereafter, a final selection meeting will be held between June 26th and July 1st, with finalists selected and identified in mid-July. The program begins on September 1, and all leaders selected for the Culture of Health Leadership Program must participate in the required in-person program launch between September 26th and 28th in Princeton, New Jersey. We're going to offer you opportunities to ask additional questions by visiting our website at www.cultureofhealth-leaders.org, or you can email us at info@cultureofhealth-leaders.org. And questions about the broader Advancing Change Leadership programs can be emailed to changeleaders@rwjf.org. I'm going to turn it back over to Nahanda Lindsay for additional information.
So thank you very much to all of our presenters for providing us with a comprehensive overview of the Culture of Health Leaders program. I wanted to bring to your attention a few more items. Just in case you're not aware, the resources you see listed here to your right or to the right of the presentation are accessible during the recording. They will also be available on the Culture of Health Leaders website that Brian just mentioned before. And then as Teresa mentioned as well, the presentation includes responses to questions that were already submitted prior to the webinar. However, if you feel you have additional questions or things that you need to get cleared up, please be sure to send them to info@cultureofhealthleaders.org. We'll have this recording available until the application deadline date of April 19th. And finally, once you've reviewed the webinar, feel free to tweet about it. Don't forget to follow us on social media. And thanks again. We look forward to seeing your applications online.